Okay, so I'm going to demonstrate how to do a health check of a dog. So this is my dog Ivy. So we're going to start, we're going to start at the tip of the nose, and then we're going to end up at the base of the tail. So starting off with the nose, we want to examine the nose firstly. We want to make sure that it's nice and clean, it's nice and clear, there's no discharge, there's no mucus, there's no blood, there's no swelling, there's nothing untoward going on with the nose there. As you can see, she's sniffing away, so she doesn't have any foreign bodies, there's no obstructions at all within the nose. Good girl. So next up, we'll have a look at the eyes. So again, we want the eyes to be nice and clear, nice and clean, nice and bright, no discharge. The eyes aren't runny, there's no kind of excess tear production at all. We can kind of gently open the eye up, and we want to look at the whites of the eye, and they are exactly that, they are white. So there's no discharge, there's no conjunctivitis, no redness, nothing we're worried about within the eyes at all. Next up, we can have a look at the mouth. Good girl. I know, good girl. Let me have a look. We can look at the mouth. So we want to pull back the lip and look at the teeth. So the teeth should be a nice white-ish colour. So Ivy is about 7, so as you can see, there's a little bit of tartar on the canine. Good girl. Let me see. Good girl. Little bit of tartar on the canine, but nothing to worry about. I don't personally brush Ivy's teeth. I probably should, and if I did, they probably would be a wee bit cleaner. So there's no bad smells coming from the mouth either, which is good. You've been a good girl. Just want to look at our gums very quickly. So our gums are a nice salmon pink colour, and when I press down, you can see her capillary refill time is less than 1 second, so she's nice and healthy. So next, going to have a little look at our ears. So our ears should be nice and clean. Oh, one moment, right, sit down. Good girl. Nice and clean. There's no bad smells coming off of them. There's no excess wax. There's no scratch marks that would maybe indicate ear mites. Nothing like that. So they're all looking good. We can just look at both sides. Looking good. Well done. Good girl. So next, I'm just going to have a little palpate of the face, and I'm just kind of having a feel for any lumps or bumps. So we want the face to be nice and symmetrical, so can't feel anything untoward. And then I'm going to work my way down her body, feeling her chest, working our way down her legs. There we go. Looking at her nails, so her nails are nice length, they're not overgrown, and look at the dew claw as well. Same with this one. All good. We can then look at our wee pads, so making sure there's no cuts, there's no abrasions, there's no soreness. As you can see, she's allowing me to touch all of her legs properly. Oh, right, sit down, pal. Sit down. Good girl. She's letting me touch her legs properly, so there's no soreness or stiffness there, which is really good. Well done. And then I'm just going to work my way down her body, having a palpate of her abdomen, and then work our way down her back legs. So again, just feeling out for any lumps or bumps, any abnormalities, any scabs. Can also feel for any ectoparasites at this time as well. And having a look at the back legs, again looking at the pads, they're totally fine. Looking at the nails as well, still a normal length, all good. Good job, good girl. And then, do you want to lie down for me? Come lie down. Come lie down, good girl. Right, lie down. Lie down. Good girl. So we can just look at her mammary glands, okay, her nipples. So she hasn't had puppies, so they're not enlarged, they're not lactating. You can see a couple more a little bit dirty because she's been out of the park today, but that's nothing to worry about. It's just a little bit of hygiene there. Looking at her genital area, so they're nice and clean, clear, there's no discharge, no bad smells, there's no urine scalding. These marks here are just kind of Ivy's regular coat colour, that's nothing to do with feces or urine. And we can have a look at her anus as well. So it's nice and clear, nice and clean, there's no discharge, no fecal build-up, no bad smells, nothing there to worry about. And then lastly, we can just have an overall look at her coat. Okay, so as you can see, she's got a nice shiny coat, nice and full, there's no bald patches, there's no presence of kind of dry skin anywhere. As you can see also her demeanour, she's been very happy with me touching her in lots of different ways today. She's not sore, she's not kind of shying away from any areas being touched. And we can just also look at her body condition score. So Ivy is a nice healthy weight for a Labrador. Labradors can sometimes be a bit overweight, but naturally what you want to see is you want to see there be a little bit of a waist. So you'll see here that her ribs come out and then her waist comes in at the end as well. So she's a nice healthy weight.